Alright guys, we're going to do cranial nerve testing. You should watch the other video of cranial nerves, know their names, their functions, their compositions, the names of the test, which are in the lab handout as well. I'm just going to show you how to do the test and know their neurological deficits, like if cranial nerve 1 is damaged, what's wrong, or what will the patient experience. That would be loss of smell. So I'm going to go through cranial nerves. The first cranial nerve is olfactory, which is going to test your smell. So the name of the test is called the sniff test. You do have 2 cranial nerves, so you have to test both cranial nerves with different smells. So you can have someone at home, they can close off one nostril and you pick a common spice and then you tell them to sniff the spice. So close your eyes, close off one nostril. What smell is this? Cinnamon? Cinnamon! Alright, cranial nerve, her left side is good. Now we're going to check her right cranial nerve. Close off your left nostril. Okay, what smell is it?
Garlic?
Garlic. So her cranial nerves are intact. If she had a neurological deficit, she wouldn't know or wouldn't be able to smell. So the next test is going to be for optic. Your optic cranial nerve helps you with vision, but there's 2 tests. So if ever asked the name for a cranial nerve for cranial nerve 2, you're going to give both names of the test. So the first test is called the Snellen eye chart. The Snellen eye chart looks something like this. You've seen these at doctors' offices. You stand back about 20 feet and you close one eye and you ask your subject to read the lowest number. You could pretty much choose a magazine or anything and say, what word is this, and check their optic nerve. So this is what a Snellen eye chart would look like. So I'm going to use this and test Bailey. So close off one eye, cover one eye, and read this line.
T-O-Z.
Great job. Now switch the other eye. We're going to read another line.
L-P-E-D.
Now, I just picked any random lines because this is not an accurate Snellen eye chart. I just drew this out. So the second test for cranial nerve 2 is called the pupillary light reflex. So you can use a phone, a flashlight, any type of light, and you're going to shine the light in their pupil and look for it to constrict. That's what your pupil should do. So cover your right eye. Her pupil constricts. Cover your left eye. Her pupil constricts. So she has a normal pupillary reflex. Okay, cranial nerves 3, 4, and 6 make the eyes do tricks. So we're talking oculomotor, trochlear, and abducens. So the test for 3, 4, and 6 is called the H pattern test. You draw the H and you have your partner follow it with their eyes, and if they can't follow the H with their eyes, then they would have problems with cranial nerves 3, 4, 6 depending on the eye movement. So the H pattern test, follow my H. You don't move too fast and you don't move too slow. If you move too fast, the eyes can't track, but that tests cranial nerves 3, 4, and 6. Now the abducens is the only cranial nerve that makes the eye track out this way, so follow my finger. So the abducens is working on this side because it makes the eye move laterally. So if that one was damaged, you wouldn't be able to take your eyes laterally. Okay, cranial nerve, let's see, 5 is next. 3, 4, and 6 makes the eyes do tricks. Cranial nerve 5 is the trigeminal. It comes out right here by your ear. It branches into the ocular branch, the maxillary branch, and the mandibular branch. It has motor and sensory functions. So its sensory is facial sensation, also in your eye, and its motor is going to control the muscles of mastication, and right here's your masseter. So the sensory test is called the facial sensation test. What you do is you take a toothpick and a cotton ball and you test their skin in all 3 areas on both sides to make sure that they can sense dull and sharp. So they close their eyes and tell me if this is sharp or dull.
Sharp. 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 Dull.
Facial sensation test. Now you would want to mix it up. Okay, now the motor test for trigeminal, cranial nerve 5, is going to be a bite test. So you place your fingers over their masseter and have them bite down. Contract on both sides, that's a normal test. Okay, cranial nerve 7 is facial expression. Facial expression test because it has motor and sensory, so its motor functions as facial expressions. It also controls your lacrimal glands, your nasal glands, some salivary glands. But facial expression test is the motor test for cranial nerve 7. So you basically ask them to smile, frown, pucker your lips, wink. Facial expression is symmetrical bilateral. For sensory, the cranial nerve 7 is on the front of the tongue. The anterior 2/3 of your tongue is controlled by cranial nerve 7 for taste. The very back of your tongue is glossopharyngeal for taste, posterior 1/3, and then the back of your throat you actually have taste buds for cranial nerve 10. But the taste test is primarily for cranial nerve 7. We have different tests for cranial nerve 9 and 10. So the taste test is for cranial nerve 7. So I am going to hand her a Jolly Rancher and she's going to tell me the flavor. So you can have any candy at home. You can also test salt, something bitter, something sour. That would be a great way to test cranial nerve 7. Alright, what's the flavor, ma'am?
Watermelon?
She's wrong, it's green apple, but that's okay. That's cranial nerve 7. Okay, the next test is cranial nerve 8, which is vestibulocochlear. Now there's two branches. The vestibule is for balance, so stand up for me and close your eyes, and I'm checking her balance. Perfect, she has balance, sit down. So the balance test is for the vestibular branch. If you damage that, loss of equilibrium. But the cochlear branch is for hearing, and there's two tests for the cochlear branch. They're called Weber's and Renee's. These are going to assess you for your cochlear branch of the vestibulocochlear nerve, cranial nerve 8. Weber's. Can you hear this equally on both sides?
Yes.
So I'm using a tuning fork so y'all can hear that. Weber's is on the top the way I remember it. Weber's, it kind of makes a W, so I just remember Weber's like on the top of the head. Now the next one is called Renee's. Renee's sounds like ringing. Renee's, I don't know. It kind of sounds the same. This tests bone conduction for hearing. So you place this tuning fork on the back of the mastoid process and you see if they can hear the sound. Can you hear that?
Yes.
And can you hear that?
Yes. Yes. Yes.
It's always going to be louder when you hold it next to your ear than it will be for bone conduction, but if there's one of those they can't hear, then we know that the bone conduction is messed up. Okay, cranial nerves 9 and 10 we test together. Cranial nerve 9 is glossopharyngeal, glosso meaning tongue, pharyngeal meaning pharynx. It's on the back of your throat, so it controls your pharynx muscles. So it's going to be for speech, which we call phonation. And cranial nerve 10, which is vagus, controls all of the back of the throat. I don't know if you'll hear the train, it's distracted me. But the two tests for cranial nerve 9 and 10 are called the phonation test, where you open their mouth, or they open their mouth and you look in their mouth and they say ah, and you're looking for the uvula to rise. And then the other one is you would take a tongue depressor, which we're not doing, and you would touch the back of their throat and see if they have a gag reflex. You can simply say, do you have a gag reflex when you brush your teeth and you place your toothbrush too far, do you gag? So she has a gag reflex. So for the phonation test, you have them open their mouth, you're looking for the uvula to move. Say ah.
Ah.
Her uvula moves, so she has a normal cranial nerve 9 and 10. So the next test is for cranial nerve 11, the spinal accessory. This is the only cranial nerve that controls the sternocleidomastoid and trapezius muscles on the neck. Every other cranial nerve is confined to the head. So the two tests are the shoulder shrug test, which checks the traps, and then the head rotation test, which checks the sternocleidomastoid, which is right here. So you have them shrug their shoulders. Shrug your shoulders, ma'am. Don't let me push down. Okay, strong on both sides. Rotate your head to this side. Don't let me rotate your head, and then to this side. Okay, so head rotation test and shrugging your shoulder test. The last one is cranial nerve 12. Cranial nerve 12 is called hypoglossal. It only has motor composition, so it controls the tongue movement. So it's called the tongue movement test. So place your tongue in the cheek of one side, and don't let me push it. Strong on this side, strong on that side. So those are your cranial nerve tests. Again, they're written in your lab handout. You'll learn them better if you practice them on someone. They're on the post lab, they're on the quiz, and they're going to be on the lab practical, fill in the blank. So make sure you know your cranial nerves, know the names of your test, know the compositions, the Roman numerals, and what happens when it's broken, neurological deficits.